Boris Johnson was upbeat about Britain's record on coronavirus when he returned to work last week, but that cheery optimism was less evident today. The rising death toll may have played a part, also that he was about to face a new adversary at the dispatch box.
Oh, I'm looking forward to it, and I'm glad to see he's back in Parliament.
I now call the Leader of the Opposition, Keir Starmer.
His first question, why was the number of deaths here so high?
It's the second highest in the world. That's not success, or apparent success. So can the Prime Minister tell us, how on earth did it come to this?
Every death is a tragedy, and he's right to draw attention to the appalling statistics, not just in this country, but of course around the world.
The statistic nowhere more appalling than in care homes, suggested the Leader of the Opposition. The Prime Minister again agreed.
He's absolutely right to say that there's an epidemic going on in care homes, which is something I bitterly regret, and we've been working very hard for weeks to get it down.
But for many MPs now, the main worry is uncertainty over how long the lockdown can continue, given the high economic and social costs. The Prime Minister today offered some hope changes could begin next week.
We'll want, if we possibly can, to get going with some of these measures on Monday. I think it would be a good thing, Mr. Speaker, if people had an idea of what's coming.
But in the northwest of England, where there are now more cases than anywhere else, some are urging caution, fearing that easing the lockdown too early could be dangerous.
The test I will be setting the government over the coming days is they need to prove to us that it is safe to implement these measures now, as safe in the northwest of England as it is in London or the southeast.
The government seems keen to lift some of the more extreme social restrictions in the coming days, but it's unlikely it'll be business as usual for most of us anytime soon. Libby Vina, News at 10, Westminster.